Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, as usual, we have an exciting show for you today. We're going to talk about a topic that I think everyone is going to be interested in. Stay tuned. But first, I want to talk to you about sharing and caring. I love the emails. They are excellent. And the tweets, out of sight. Listen, keep emailing me. www.medmoments.com. And you can tweet me as well, @medmoments. Well, we have a show that I'm so excited about because we're talking about a disease that is pretty rampant out there in certain communities, and we're going to talk about this. We're going to talk about sarcoidosis, and I have the perfect person to go over this topic. Her name is Jennifer LaRosa, and she is Director of Critical Care at Newark Beth Israel Medical Center. Dr. LaRosa, welcome to our show.
Thank you, Dr. Bey. A pleasure to be here.
Oh, it's so good to have you back again.
Thank you.
Yes. You're becoming a regular around here. You know that.
It would be my honor to be one. Thank you so much.
All right. Listen, let's just get to the nitty-gritty of it.
Okie doke.
What is sarcoidosis?
A frustrating disease that you don't want to have.
That's the truth.
Yes, it's a disease in which the lymphocytes, those are cells in our body that help us fight infections, especially as we go into the winter and flu season, everybody getting colds. Right. These lymphocytes get a little overeager, a little overactive, if you will. Right. And they all kind of stick together and they form a knot, and that knot of inflammation can affect loads of organs in the body. The lungs, the eyes, the heart, the liver, the spleen, the skin, you name it.
Oh boy.
And it causes those organs to not function as they should.
Okay, all right. Let's step back just for a minute.
Sure thing.
Now, you said a lymphocyte. What is a lymphocyte?
A lymphocyte is a certain type of white blood cell. Mm-hmm. And white blood cells are something that our bone marrow produces to fight infections.
Okay. So if I had, say, pneumonia.
Yep.
Then something in my body would be pushing out lymphocytes so I could help fight that pneumonia?
Yep. Our bones, all the bones in our body, are actually kind of hollow. Right. And they have material on the inside that produces these cells that are released into the bloodstream. And they're called neutrophils, lymphocytes, monocytes, and they all help your body fight an infection.
Okay. So with sarcoidosis, and I just love this name. You know, I don't know where this name came from, but I don't think we could produce two of them. You know what I mean?
No, I don't think so.
It's that rare. With sarcoidosis, this lymphocyte, what happens to it? Why is there a problem with this particular cell?
I don't think anyone knows the exact answer to that. And I think another way to say that question is what causes this? Okay. And these lymphocytes all stick together and they form what's called a granuloma. And it's kind of a little knot of inflammation. And it turns over time, in a lot of folks, into scar tissue. Okay. And that's what makes the organ that it's affecting not work.
Okay. When you say inflammation, explain what you're talking about when you say inflammation.
Inflammation is swelling.
Okay.
So if I get a burn on my hand and it turns red and it gets puffy and it's very tender, that's inflammation. Okay. And that can happen anywhere in your body. Okay. Your heart can get inflamed. Your lungs can get inflamed. Your skin can get inflamed. Right. Any organ, any part of your body can get inflamed.
Okay. Is this an abnormal cell? I mean, is it produced and it's produced such that it doesn't work properly, or it's abnormal, or it looks funny or something to the other cells, or is it a normal cell just overproduced?
It's normal to have lymphocytes. Okay. These lymphocytes are not behaving normally.
Okay.
They're almost attacking the body, if you will. It's kind of like the body attacking itself. It's not completely different than what we call autoimmune diseases, which is where the body sort of begins to fight itself. It's not technically classified as an autoimmune disease, but it's very similar.
All right. Now, you said that this disease can be present in so many areas of the body.
Yep.
Is there any particular areas that it's always present?
The commonest areas for it to be present in are the lungs, the skin, and the eyes. Okay. After that, the liver and spleen are reasonably common, and sometimes even the brain and the central nervous system. And that just means the brain and the spinal cord and the nerves.
Okay, okay.
It can also cause arthritis.
Oh,
yeah.
All righty. So what you're talking about is that in these particular organs, this lymphocyte clumps together and it forms this little knot or granuloma and causes things to, and what does it cause? It causes like the brain not to function, or you can't think, or the lungs not to be able to breathe. How does it happen?
That's exactly right. So in the lungs, what it does is it prevents oxygen from moving from the lungs into the bloodstream, for example. In the brain, it can make the nerves of your face stop working. If you've ever seen somebody with a Bell's palsy where one side of their face is paralyzed and droopy, that can be from sarcoidosis.
Oh, goodness.
It can cause a rash on the skin, often on the legs, often on the neck or the back, sometimes even in the face, and it can be disfiguring. There are famous people who have these diseases, and the skin isn't acting as it should, and it becomes disfigured and abnormally shaped.
Oh, goodness. Now, if you were in your office and someone came walking in, or a patient came walking in, I should say, how would they present most of the time if you thought they had sarcoidosis?
That's the interesting thing about sarcoidosis. The symptoms are what we call very nonspecific. So patients typically have fever. They typically have weight loss, and they just feel tired. They just don't feel good. Those who come in with lung problems, and again, it affects the lungs a fairly consistent amount of the time, might come in with shortness of breath or cough.
Okay. Now, why would you be short of breath? I mean, and cough, is it like a bronchitis, or does it affect the airways like a bronchitis does, or does it affect the tissues of the lung, or what does it exactly affect?
It does both those things. It's sort of like a bronchitis that won't go away. So a bronchitis that's persistent, if you feel like you've had the flu for a month or for 6 weeks, sarcoidosis might be something that your physician should think about.
Oh, all right then, all right. Now, when you talk about rashes, because that's something that we all get, everybody gets a little rash every once in a while. If I got a rash, should I be worried about it? What type of rashes is it? Like a poison ivy that is going to itch all the time, or is it like something that's going to turn blue? If
I hope not.
You know.
It's typically, there are two kinds of rashes associated with sarcoidosis. One is called erythema nodosum. And it's, I know,
That's
fancy
a fancy
name.
word.
Right. Don't worry about the fancy name. Let's just call it sarcoidosis rash. It often occurs on the shins and on the back of the neck and the back. It's typically not itchy, but it's red and it's raised. It's kind of bumpy. Okay. Then there's something called lupus pernio. Another fancy name. That's a facial rash that's associated with sarcoidosis and is often disfiguring. The tissue can look like folks who've had real bad acne or who've had burns on their faces. And the rash gets very severe at times and actually dissolves into the cartilage, that kind of soft tissue in our nose, and deforms the face.
Oh, goodness. So if it can be in the airways and if it can be in the nose, do you have symptoms like allergies and sinusitis or something like that?
Absolutely.
Or you said bronchitis, but what about like asthma and wheezing? Do you get that too?
You can. You absolutely can. You know what we say at Newark Beth Israel about sarcoidosis? It's always in the differential.
Oh, got you. All right.
Always in the differential.
It just may be there, so you got to look for it.
That's right.
All right.
That's right.
I hear you. I hear you. Now, is there a certain age patient? Is it like mostly in children, or is it mostly in seniors? When does this present itself?
Good question, really good question. Of course, any disease can present in anyone of any age. This disease typically presents in people who are somewhere between 20 and 40 years old. Generally speaking, that's the case.
All righty. And what about genetics? If mom has it, then am I going to have it 100%?
Not 100%, but there's about a 5 times increased likelihood that if you have a first-degree relative, that is a sibling or your mom or dad or a child with the disease, you have a 5 times increased risk of having it.
Okay, all right. Let's step back for a minute.
Okay.
What causes this problem?
I wish I knew. That's the million-dollar question, isn't it? If I knew that, I could make a lot of people very happy.
But are they out there trying to figure it out?
They sure are. They sure are.
I mean,
there have been some associations with certain types of work. So people who work in the Navy, people who work in shipyards and with building materials, people who have had mycobacterial infections for some reason.
Yeah,
another big one.
Yeah, what's that? Just explain what it is.
It's tuberculosis and its relatives.
Gotcha.
Let's call it that.
All right, gotcha. So
folks who've had infections like that seem to be at increased risk.
All right.
Certain populations seem to be at increased risk.
Okay.
African Americans, Scandinavians, and Japanese.
Oh. Interesting. So why did we pick those?
Very random, but there you
knows?
are, right? And we don't know. We do see that identical twins typically, if one has it, the other one generally will have it. But there are not a lot of good studies looking at this.
Now, everybody that gets this disease, do they all become very severe? You understand?
Sure.
Do they all? I mean, I know it can be life-threatening because I remember not so long ago, maybe about a year ago, Bernie Mac, let everyone know that he had sarcoidosis.
That's right.
And he died from it.
That's right.
So this is something that I know can be serious.
Yeah.
But is everybody at risk for dying with this disease?
Well, that's the good news. To the extent that there's ever good news when it comes to disease. Roughly 70 to 80% of the people who get sarcoidosis, it goes away on its own. I think that we have a lot of folks who have sarcoidosis or who have had sarcoidosis and don't even know it. And that's the good news. Unfortunately, 5 to 10% of these folks do develop very, very severe disease.
Right.
And unfortunately, that was the case with Mr. Mack, who did die at the very young age of 49. It was tragic.
Are there any risk factors, meaning that if I smoke or if I drink too much or if I take my walks in the morning are too long, am I going to get it? You understand what
I sure do. I sure do. Exercise is a good thing, and we definitely want to get more folks out there exercising. Smoking doesn't make anything better. Right. So smoking is always something that you should stop. But if you've got lung disease in addition to smoking, you're asking for trouble.
Right.
Absolutely.
Okay. All right. Now, the major symptoms that you say is shortness of breath. Is there any pain associated with this? Because this is like all over the body. I could imagine that people are having kind of a little bit of difficulty as far as this disease.
Shortness of breath. It can affect the joints in addition to the lungs and the skin and the eyes and everything that we talked about.
Right.
I had a patient recently who came in and just said that she had blurry vision, but otherwise felt well and had sarcoidosis of the eyes and tremendous sarcoidosis of her lungs.
Now, what are they supposed to do? Should they go to their eye doctor or ophthalmologist if they think they have, you know what I mean?
Sure.
If they think they have something wrong like this?
Absolutely, absolutely. Eyes are not something that you mess around with, and sarcoidosis of the eyes is a very serious disease.
Right.
Those patients need to be followed by a primary care doctor, a pulmonologist like you and I are,
right,
and an eye doctor, an ophthalmologist.
Okay. Step back.
Yes, sir.
Very important question. Can this turn into cancer, or is this cancer?
No way.
All right.
It's not cancer, it's not going to be cancer, it's not going to turn into cancer, and it's not associated with cancer.
All right.
Nope.
All right. That's very important because everybody worries about the big C.
Sure.
You know what I mean?
Yep.
All right. You say that the symptoms can leave, but do you really get rid of it? Or is it always kind of lurking in the background that it could present itself again in sometime in the future?
There is a relapse rate. There are a certain number of patients who get the disease again. The symptoms go away, the abnormalities on the chest x-ray or the skin go away, but then it comes back at a later time. But remember, most of the patients remit completely. Oh, wow. And either they don't present again, they don't have symptoms again, or they present again in a way that they're not affected by it, but they have an abnormal chest x-ray.
Oh, all right then.
Most of these patients, the disease goes away. Having said that, I don't want to give people the impression that it's okay to just say, well, it'll probably go away, I'll just ignore it.
Right.
Because you don't want to be one of those folks who have the disease progress and get very, very bad and end up like poor Mr. Bernie Mac.
Right. Now, let's just talk about trying to figure out when someone comes to your office, how do you diagnose them? How do you know if that person actually has sarcoid? What do you do? What tests do you run, or what, you know?
Great question, great question. And people have been looking at this for over 100 years. They used to do a great test called the Quine-Silsbach test, in which they would actually,
one of those
I'm
words.
sure I didn't pronounce that correctly, where they would actually inject patients with a little bit of sarcoidosis from another patient. And then they would see if sarcoidosis formed in the patient in which they were looking for it.
Right.
They don't do this test very much anymore.
Thank God.
Thank God. Yeah, I think that's probably a good thing. Listen, the gold standard for any diagnosis is that you want to have tissue.
Right.
If there's something on the skin, you want to take a little bite of it, send it to the pathology lab and look at it under a microscope. If it's in the lungs, ideally you want to go in with a little camera and a knife and bite off some pieces and send it to the lab.
Right.
You want to get that tissue in the easiest way that you can get it.
Right.
If it's on the skin, piece of cake. Going into the lungs is a little bit more difficult.
Right, right.
There are also some blood tests that you can check, specifically an angiotensin converting enzyme.
Okay.
Let's just call it ACE.
Yes.
An ACE level.
All right.
But it's kind of nonspecific.
Okay.
It's not absolutely going to say this person definitely has sarcoid.
Right. But what it does probably is perk your ears up that it might be.
Exactly.
So you go on to the next.
Exactly right.
All right.
Yep. Yep. And there are chest x-ray findings that are real typical for sarcoid.
Right, right.
But ultimately, if you want 100% certainty, you got to get that tissue.
Right, right. Now, I know some, I read that like dry mouth and dry eyes, why does that happen? What happens with that as far as sarcoid is concerned?
Well, we have little glands right here in our cheeks called parotid glands. And we have lacrimal ducts right here that allow us to cry.
Okay.
And sarcoidosis can affect those. And when it does, those little knots of lymphocytes that we talked about, they clog these things up.
Oh,
so your mouth gets dry and your eyes get dry. And a lot of folks say, well, I just normally have dry eyes or dry mouth. It's part of my allergies.
Right.
It could be sarcoidosis.
Does it affect the heart at all?
It can.
Oh goodness! How does it? Does it make the heart? What does it do? Well, you know what I mean.
Yeah.
The beats go off, or does it get enlarged, or does it? What happens with the heart?
Well, interestingly, on autopsy, so when patients have passed away with sarcoidosis, about 25% or a quarter of them seem to have their heart be affected. But in life, only about 10% of them have heart problems associated with sarcoidosis. Okay. Those problems are usually what we call conduction abnormalities. So the heart doesn't beat right.
Right.
It beats in a funny way. You know that fluttering you feel in your chest before, say, going on television?
Yeah, I know that one.
That can be even worsened in someone with sarcoidosis.
Okay.
And it can turn into what we call an arrhythmia.
Okay.
And it can kill you.
All right then. As far as the chest X-ray is concerned, and I know because I'm a pulmonologist, this is a very interesting aspect for me. How do we stage this disease to know that this patient is likely to be a severe patient? This patient is likely to be a a patient that's not going to be not so bad.
There are 4 stages of sarcoidosis when we talk about chest x-rays. The first one involves the lymph nodes.
Okay.
So if you feel your neck, those little buttons that you feel underneath your chin or your jaw are lymph nodes. And that's what makes lymphocytes. Remember we talked about those? Well, the bone marrow makes the lymphocytes, but the lymph system is involved.
Right.
So stage 1 sarcoid, just the lymph nodules of the lungs and the middle of the chest are involved. In stage 2 sarcoid, it's the lymph nodes and the lungs themselves. The part of the lungs that are
the lung tissues.
The lung tissues.
Yeah,
the part that's doing the breathing.
Right.
Stage 3, drop the lymph nodes.
Okay.
Now
no lymph nodes, just tissues.
Exactly.
Okay, I got you.
And none of those 3 types portends a better or worse prognosis.
Okay.
But then you got stage 4, and that's bad. That's when the sarcoidosis is really severe and it's turning into something called fibrosis.
Oh.
So let's go back to when I burned my hand and had inflammation and swelling.
Right.
Over time, that's going to turn into a scar.
Right.
The same thing happens with the inflammation in the lungs from sarcoidosis.
Oh.
All that inflammation and swelling and redness turns into a scar. And when the lung tissue turns into a scar, it's not working anymore.
Okay. Okay.
That's when you're not breathing right and you're not getting oxygen.
Okay. So that scar, when you take a deep breath in, I can imagine that there's oxygen in the air that I breathe in.
Yep.
And when that oxygen tries to go across the membrane from the lung tissues into the bloodstream, if there's a scar there,
can't get there.
It can't get over there. So I'm going to be, I won't have much oxygen in my blood.
You got it. There's a big brick wall.
Oh boy, that's
Yeah.
something else.
It sure is.
Now, what about as far as weight loss? Do you lose weight with this? Does it affect your appetite and all of that type of stuff as well?
It does. Patients typically have decreased appetite and present with weight loss.
Okay.
This is not typical of many of the diseases we see where people are gaining weight.
Right.
And people come in worried, as you correctly identified, about cancer. They come in saying, I'm short of breath, I'm coughing, I have fevers, and I'm losing weight. I must have cancer.
Okay. Alrighty. Now, and when you cough, is it a lot of phlegm, or is it like is it a dry cough, or a rattly, or wheezing? I mean, I can imagine that everybody coughs.
Sure.
So, and I understand that you said this is non-specific, but sometimes I don't want the whole population coming to your office at once because of this show and saying, oh, guess what? I have sarcoid because I'm coughing.
Right, exactly. Well, it runs the gamut. It runs the gamut. The truth of the matter is, most of the time, it's a dry cough.
Right.
Patients aren't producing a whole lot of sputum. It's not like when you have pneumonia or heart failure and there's a whole lot of junk coming up.
Okay, all right then. Yeah, that's great. Now, as far as, I know that seniors tend to, even though you said it's between 20 and 40 years, can it affect seniors as well? Because I know anything that affects seniors seems to be worse.
It does.
So if it presents, then would it be the same situation for those seniors?
Yes, except that it typically does present worse.
Okay.
And what often happens is that this, like any disease, kind of wears down your ability to fight other diseases.
Oh.
So seniors, they may be 55, 65, 75, but if they got it when they were 40 and it went away, and now it's coming back, they may present in a much more severe fashion. They may present with pneumonia on top of the sarcoidosis. Okay. And in fact, that's how Bernie Mac died.
Right.
He had sarcoidosis and he got pneumonia on top of it.
All righty. What about as far as some of the effects? I know there's something called, and this is a big word too as well, pulmonary hypertension.
Yep.
And I know that can be associated with sarcoid, and it's a devastating problem when it happens. Can you explain that just a little bit, what pulmonary hypertension is?
Sure. So we know that hypertension or high blood pressure is when your blood pressure is too high, right? The blood vessels are constricted, and the heart has to work real hard to push the blood through. Right. Well, the same thing can happen in the blood vessels of the lungs. And when the blood vessels in the lungs aren't getting enough oxygen, that's how they respond. Right. They respond with hypertension by vasoconstricting or tightening down. Right. And what ends up happening over time is that those blood vessels become abnormal. They become diseased, and you can't undo it. That whole fibrosis that's happening in the lung disease we talked about, the exact same thing can happen in the middle of the blood vessel. Right.
Oh boy. That's interesting, because I know that if the lungs are having that type of problem, probably some of the chambers of the heart are having having a bad problem
too. Then the right side of the heart is having to work harder, and that can lead to heart disease.
Wow. So this is truly a disease that encompasses so many things.
The entire body.
Boy, oh boy. So what about, now, I know that I was reading somewhere about calcium in it. For some reason, there's a lot of calcium around.
That's right.
What's going on as far as the calcium is concerned?
Well, you're right. We didn't talk about the kidneys, but sarcoidosis can affect the kidneys.
Oh, all right.
And what it does there is, the kidneys filter our blood, and they help us get rid of toxins and all sorts of things. And what happens with sarcoidosis is that the disease tells the kidneys to pick up calcium and put it back in the blood. Right. And it puts too much back in the blood, and patients get high calcium levels.
Oh boy.
Yeah.
So if you're walking around with high calcium, I know calcium causes kidney stones.
Yep.
1 and 1 equals 2, that type of thing.
Exactly.
So, oh boy, so they probably have a problem with kidney stones as well.
Exactly. It's a feedback loop. The lung hurts the heart hurts the lungs, the kidneys do something that ends up hurting themselves, and round we go.
Okay, all right then. Well, I just want a few more questions as far as this disease and treatment. I know that we don't quite know what causes it. I understand that.
Yeah.
But do we have any treatments that would be effective for this particular disease?
We do. We do. Thank heavens we do. And we have steroids. And steroids are the mainstay of treatment for sarcoidosis.
Okay.
What steroids are, it's not steroids like I'm just going to make me strong steroids.
Right.
It's steroids that kind of tampen down the immune system. They make it quieter so that these cells stop squashing together and forming these knots.
Right.
And then we have things called steroid-sparing agents. And that just means other things like methotrexate or azathioprine that function essentially like steroids, but not with as many side effects.
Right, right. This was interesting, such an interesting topic, and thank you so much for coming and covering it for us.
It is my honor to be here. Thank you for having me.
All righty. We're going to, obviously, we're going to have you back again.
I would love it. Thank you.
All right, thank you. Well, I think it's time that we have our Let's Talk segment. And today I'd like to talk about stress tests, because there's going to be a time in all of our lives that we have a little chest pain, a little tightness, and we're going to say, boy, I wonder is it okay? That's when we go to our physician, and most likely he's going to send us for a stress test. So let me talk about it. It's usually called a stress test or an exercise test or a treadmill test. And what happens during this test? Basically, we put on a lot of monitors, okay? So we can monitor your heart and see how fast it's beating and see if it's working okay for you. We let you walk. And while you're walking on the treadmill, we elevate the front part of the treadmill so that it seems as though you're walking up a hill. So your heart has to work harder. And that lets us know if it's functioning okay for you. And if it's not, then of course the doctor is going to recommend further studies. But if it is working okay for you, it lets us know that chest pain, it probably was something, you lift something too heavy and you got a little arthritis around, or a little musculoskeletal or something like that. But it's always very, very important, if you have something like that, to let your doctor know. Okay, in closing, all right, as soon as I get my papers together here, there we go. Don't forget about sharing and caring. Email me, www.medmoments.com, and tweet me @medmoments. Never institute any change in your medical therapy unless you consult your physician. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Thank you very much.
Thank you
very much.
Thank you.